Dr. Mayberry again. We are continuing our skull discussion with the parietal and the temporal in this portion. So we're going to start with the parietal. The parietal articulates with the frontal at the coronal suture. So you need to realize that the anterior portion of the parietal effectively makes up part of the coronal suture. You have two parietals, so you need to understand how to side them. It's relatively simple, so we'll get into that. So there's the coronal suture, but there are also two other sutures because these are located sort of in the middle of the skull. So coronal. Down the middle is the sagittal suture. And again, that correlates with the sagittal plane. So, or the mid-sagittal plane specifically. So the sagittal suture is the suture between the two parietals. So left and right parietal, sagittal suture. This is coronal suture up here. And then posteriorly, you have the lambdoidal suture. So that's between the parietals and the occipital bone, which we'll get to in another discussion. So we have our three sutures. This is anterior, coronal, mid is the sagittal, and posterior, I should have said medial, posterior is the lambdoidal. Okay? And over here, this is going to articulate with the temporal. You don't need to know that suture. Okay? So to side the parietal, we have to know a couple other things. You need to know that, again, inside are the meningeal grooves, and those are blood vessel grooves. The blood vessel grooves, or meningeal grooves, go posteriorly. I had a TA once tell students that these were root marks. We talk about root marks in forensics. They're not. They are from blood vessels. They're from life. If you put that on there, you are very, very wrong. And certainly if you tell other people, you are very, very wrong. So those are marks from blood vessels that are supplying everything in here, your brain and the surrounding tissues, the mater. So, okay, you have your meningeal grooves. We also have the Parietal Foramen. This is a little bit variable. It's a tiny little hole toward the posterior of the parietal. There's one, usually there's one on each parietal surrounding the sagittal suture. So this is actually a trait that you can look at and correlate loosely with ancestry. So it is variable. Some people have one on one side and not the other. Some people have none. A lot of people have both. But that is, a landmark that you need to know. Parietal foramen. I think that I have everything for the parietal. So to side it, you can see there's this pointier end here. I pretend that I'm a cowboy. I always wanted to be a cowboy. So I pretend that I'm a cowboy and I am tipping my hat to a fine lady, and when I hold my hat, I'm holding this end here. The meningeal grooves should go posteriorly, so howdy ma'am. I can't howdy ma'am by holding this pointy end on this side. I'd be flipping it weirdly. Okay, so howdy ma'am, this must be a left. Okay, made that one up myself, I think. Anyway, next we have the temporal. So the temporal is basically where your ear is. So again, this does articulate, oops, get everything facing the right direction. This does articulate with the parietal. So we have more landmarks on the temporal. First, you have the external auditory meatus, which is effectively your ear hole. So external auditory meatus is the hole, and then just inferior to that is basically the bottom of the external auditory meatus is how most people think of it, but it's the tympanic plate. Okay, so the tympanic plate sort of looks like it's in this mandibular fossa area. So the ramus of your mandible and the coronoid fossa of the mandible articulates right in here, and this is the tympanic plate. So it's all right together, and then of course a fossa is a dip, so that's the mandibular fossa there. Just anterior to that, this is the back, basically, the posterior portion of the zygomatic arch. So the zygomatic is also, it's its own bone too, but the arch, the posterior portion of it, is part of the temporal bone. You have your mastoid process just posterior to the external auditory meatus. And this is pretty variable, mainly with sex. So we use the mastoid process when we do sex determination later in the semester. So you do need to remember that landmark for later. It's often broken on lab specimens but this is a model, and we do have the styloid process. So again, it's usually broken. It is very near to the mastoid process and the external auditory meatus, and it's a major muscle attachment. It's basically this stalactite of bone that's sitting there. Okay, so if you have an external auditory meatus, you must have an internal auditory meatus. So this is the external surface of the bone. This is the internal surface of the bone. And this is the internal auditory meatus. So we say this looks like a triceratops, and the eye of the triceratops is the internal auditory meatus. You do have 3 bones within the ear. We don't have any cross-sectioned temporal bones, so you won't need to be able to identify them, but you do need to know that the 3 bones in the ear are the malleus, the incus, and the stapes. And they, help you hear. So just be aware that those are in there. You don't need to visually identify them. The other landmark in here is actually the carotid canal. So the carotid canal curves a little bit, and you can see that I'm putting my pipe cleaner through it, and it's actually a little L-shaped, even though my pipe cleaner, just flexed in there. So that's the carotid canal. It's different from, you've got the internal auditory meatus there, you have the carotid canal here. So if people get things confused, it's usually those things. They get a little messed up between them. That's why I told you the eye of the triceratops is the internal auditory meatus. So I believe if I could find the temporal on my list, I could make sure that I have showed you everything. So to cite it, you mainly need to use your common sense. You have your ear, right, your external auditory meatus. This is the back of your cheekbone, your zygomatic arch. It does not go backward. So if you can put the internal or the external auditory meatus where your ear should be, the mastoid process should be posterior to it, and the zygomatic arch should lead anteriorly. Okay, so I am holding again a left. All right, so that sums up the parietal and the temporal. Ask me any questions that you have in class, and continue on to the next video.